So I want to talk today about something I thought I understood until I actually got it. Had massively underestimated shingles. Had it in March and it was genuinely awful. Painful, exhausting, not just, a bit of a rash that clears up in a few days. Now, traditionally, I had thought shingles was just something that affected older people, but doctors in the US are reporting more cases amongst younger adults, which I do count myself in, particularly stressed and burnt out women, which I definitely am. So what is happening? Is modern life affecting our immune systems? Why is it so commonly mistaken for other conditions? I thought it was mosquito bites. And what should you do? Dr. Radha Nilesh Patil is with us today, specialist dermatologist at Medcare Royal Specialty Hospital. And doctor, you're saying you're seeing up to 2 patients every day in clinic with shingles, and younger patients as well. Thank you so much for your time today. Let's start with the basics, Dr. Radha. What exactly is shingles, and how is it connected with this chickenpox virus that many of us had as kids?
Hi, good afternoon.
Hi.
Very nice to have you.
Thank you. So what's going on? What is it?
I think it's all about more awareness, one, but definitely shingles comes from the chickenpox virus. We had it when we were small. It goes in silence. It sits there in the nerves. And then once the immune system breaks down a little bit, it starts to come in. So you're right that it used to come in people over 50, and it's still most common in people over 50. But look at the lifestyle of younger women today. They are stressed. They have school-age kids. They work demanding jobs. They have aging parents. They are definitely more stressed than they were before.
Mm-hmm.
That's probably one of the reasons that this condition is affecting them more early than it should.
Yeah.
So again, coming back to the basics. So once immunity drops down, the virus attacks your system and particularly causes breakout on that side of the nerve that is affected. So it basically affects that band of the nerve where it has just broken down. So you get blisters around that band. You may have a single band, multiple bands, but it'll be on one side of the body. This excruciating pain. Sometimes the pain starts 48 to 72 hours before the onset of the rash. The rash basically just looks like fluid-filled blisters. And then the patient walks in. Sometimes they don't know what it is. They may think it's just an ant bite and ignore. But however, this rash needs to be corrected or treated as soon as possible. So that's how it comes.
It was really interesting because, as I said, I had it back in March. So beginning of the conflict, my in-laws were staying for 3 weeks with alerts going on, and I woke up one morning. Funny that, and I thought it was mosquito bites, as I had what looked like about 15 or 20 mosquito bites on my rib cage on my left side, but they weren't itchy. So you're going to really hate this, Dr. Radha. I took a picture. And I asked AI, and sure enough, prompted me on a few other questions and said, this is probably shingles. So I took myself off to the doctor, who very sweetly looked at me and said, are you a bit stressed out? I was like, yes, I am. And when I say painful, I think because it's a rash, I was expecting, just like a bit of an itch, put some chamomile lotion on and be on your way. It really, really wiped me out. So there was this massive dip in energy. I had a fever a little bit. But for almost weeks, actually, after initially going to the doctor, it felt like someone had punched me in the ribs. And I found myself walking around almost kind of sheltering my torso from the world because I felt so vulnerable. And I was really shocked by how unwell it made me. I mean, why do you... I do feel like it's massively underestimated. What exactly happens when we think about why we're so wiped out by it? Because is there a post-viral fatigue element as well?
That's correct. When you have any viral infection, think about it. When you have chickenpox, we are asked to rest, be at home. Of course, one reason is it's infectious, but the other reason is virus really drains you down. When you have COVID, you have any virus in the body, it really drains you down. So you do have fatigue, you do have a little bit of fever. Some people are okay, so it all depends on the immunity of the body. You might want to also check on your basic vitamins, maybe the vitamin D, B12, iron. Some deficiencies can really lower down your immunity. This is also found more common in my patients these days. if you can imagine, who knew about vitamin deficiencies 20, 50 years back? No one spoke about it. So all these are factors that can reduce immunity in a normal, healthy individual. So when you have these parameters reduced, and then you have associated conditions, so you could have chronic diseases, just such as chronic kidney disease or diabetes or any chronic cardiac disease, that adds to these factors. So we have all of these added up, and the pain, along with the weakness and fatigue, that's why we always offer for some painkillers, up to a point that I referred my patient yesterday straight away to a neurologist because she had it on the face. She said, "Oh, it's so bad. I just want to get rid of the pain. I'm not even so worried about the rash, but the pain is so bad." So the facial pain is really, really bad. And then when it affects the eye, the vision is affected,
Oh
so on, so
gosh,
on.
I got
So you need
I
to,
got lucky with
yeah.
my torso then. It's interesting because Ed Sheeran reportedly had it on his scalp. I was like, oh, that must be horrendous. Just coming back to meds, because I took painkillers and I took like a nerve blocker as well. Is there a window where medication can make a real difference, doctor?
After 72 hours, the is your catch. If you can really start within the 72 hours and you've seen your doctor. So that's why it's very important to recognize it. Thanks to AI for that matter. I think AI can really detect. I have had patients in the past who really couldn't come until 5 days because they kept applying some calamine lotion and some antihistamines, something to help them out, not knowing that this is actually need to be seen earlier than that they think. So if you can treat them within the first 3 days, the medicine has its best effect,
Okay.
or else it has a much slower onset and a much slower efficacy.
Can I ask you, Dr. Radha, we've been talking about some of the treatment options as well, but is there a seasonality aspect to this? I think of shingles being, as I said, something that old people get in the winter. Do you see more cases in hotter months, colder months? Any patterns there?
Sure, I know when you put me a question with summer. So summer basically has more cases, and that's when we see it more often. And that's where the last few months, last month particularly, since it's been getting a bit hot. So the virus seems to be coming more in summer, perhaps because there's a stress, fatigue to the body. So the immune system is a bit on the lower side, and that's why the viruses are more common in this month. However, you spoke about the upper lip blistering, which
Yeah,
may not be
we've had a
shingles.
message here for you from Anonymous saying, I keep getting cold sores when I'm stressed. Is that connected
That's
to
diff
shingles or is it a different virus?
Yeah, it's a different virus. It's also a herpes virus. By the way, herpes is a herpes zoster. And when we talk of simplex, that's on the lips, the small little blisters, they're not so bad. However, they do cause some stinging pain, and they're also seasonal. If you ask people, they're also seasonal with more occurrence in summer. And that's a different virus. It has a similar treatment, but not the same. And it does not have so much impact post-viral. Just like,
Let's stay with the text line because Ellie's been in touch, and I said earlier that for weeks after the rash had even cleared up, I still felt really vulnerable, really sensitive on my rib cage. It felt like I'd
that's
done
right.
6 rounds in the boxing ring, like as if someone had bruised my ribs. And Ellie's
Mm,
saying
it's
my rash disappeared, but months later the area still feels super sensitive. She hasn't said where, but how long to expect for full recovery?
So the sad news is it's usually a month, but it can be for lifetime, unfortunately. So here's the role of the neurologist, where we refer them to follow up on these cases who have developed what is called as post-herpetic neuralgia. And that is the most important and the most common complications of shingles, other than pneumonia, stroke, some other things. But scarring, of course, sometimes vision loss if it affects the eye. But the most important and the most common is the postherpetic neuralgia, which is an ongoing pain, usually takes a few months. Sometimes it appears a month after the attack. So it's important that we tell our patients and to our audience listening that if you have a pain and it disappeared for a few weeks and it comes back in the same area, go back to your doctor, go back to your neurologist and your dermatologist to speak about it if we are still dealing with the same pain, and they'll help you out on that. So that's where it gets a bit
Oh,
tricky,
it is.
and the neurologist has to get involved.
I think the mistake that I made, and listen, as I said, it was back in March, there was a lot going on, was not resting enough. I think I was, back to work within a few days, and then that post-viral fatigue. then it became this vicious cycle of not having enough energy to go to the gym, not having energy because I wasn't exercising. I lost loads of muscle over the last couple of months, and it's only in the last month or so I felt
You
the
need to take a
energy.
week break. Once you
Yeah.
get shingles, I tell all my patients, stop work. I'll give you a sick leave certificate. Take rest at home.
Oh, I needed
You
you.
cannot. You cannot be working in zoster.
I know. It was tricky times. It really was. Right, we're going to have one question from Jaden and then one question about vaccines. Jaden's
Sure.
saying, if my child hasn't yet had chickenpox, could they catch something from me if I have shingles? Good question. Coming
That's
back to
correct.
a relation at the top. Go on.
That's correct. As you know, chickenpox is very contagious, but shingles is not contagious if the person has had chickenpox in the past. But if a child has never developed chickenpox in the past, then there is a chance they may develop chickenpox, but not shingles from the person they are in contact with.
Okay.
So we give advice to the patients to stay away from small children who have yet not been vaccinated, and also from the pregnant women around.
I would also add to that in-laws who were staying with you for 3 weeks during the conflict. I locked myself away quite happily for a few days because my in-laws who are late 70s, early 80s had not had the vaccine, which comes to that. Let's talk about the shingles vaccine. It is recommended for a kind of older age group, but I do wonder if you've had shingles, is it recommended? Are there any side effects that we need to be aware of?
They say above 50 recommendation is 2 doses apart. Two doses with 2 months apart, 2 to 6 months maximum duration. However, you can take it at an earlier age. Even if you've had shingles, it helps. It does have a preventive role according to all the research and data. So you could definitely go ahead and take the vaccine, even if you've had chickenpox in the past, even if you've had shingles in the past. For people over 50, it's definitely recommended.
I know I said the rash wasn't itchy. However, a lot of people do really struggle with that. Are there any topical treatments you recommend as a dermatologist, Dr. Radha? Is it a case of going back to the old school with a chamomile lotion and just being pastel pink for a few days?
Actually, that works the best for all viral infections when you have chickenpox, when you have shingles. But you have Zovirax, which is very commonly available. It's an antiviral. It's the same cream that you get it when you go to a dermatologist. But however, you can still get it over the counter. Zovirax works very well. It's an antiviral. However, and there is no harm taking it, even if you've had a suspicion. However, an oral course is recommended. But if you've already been to the doctor, taken your course, and then you want to apply calamine lotion just to have a cooling sensation, it's pretty brilliant.
Now, we've been talking about the impact of stress on our skin, shingles in this case, but kind of zooming out with your dermatology expertise, where else can stress show up when it affects our skin? Is it around aging? Can people have a stress response, like an eczema flare-up? Do we perhaps underestimate the impact of stress on our skin as an organ?
Absolutely. All the skin conditions that are chronic inflammatory disorders also may have an effect. That's an added point. No doubt an aging is a reduced immunity. So the new data as of the March 2026, the University of Minnesota, that has gone viral, I think from there a lot of articles have been published, that speaks of a 31% rise in incidence of cases in young adults. And that's a very high number, I feel. And that is to do with, for healthy individuals, I think a lot of people who are dieting, who've been on a Manjaro and a lot of things, I think that's one factor that has a part impact on reducing your immunity. If you're not adjusting your diet according to your weight loss or your stress or levels or your work patterns, then that's an added factor. Aging is obviously, there, and then you have chronic conditions. We spoke about any chronic condition. It could be a skin-related, it could be, autoimmune diseases. It could be very high link with, very strong link with a chronic kidney disease, with shingles and cardiac implications, and also pneumonia. So anything that disturbs your body factors are going to disturb your immunity and going to have a higher risk of lowered immunity.
Do not ignore that rash. Dr. Radha, thank you so much for your time today. Really interesting that when I saw those stats out of the US, I was like, that's me. I am a stressed millennial woman who had shingles. And I felt much less alone. And then Sophie, who was in the studio earlier, as I said,
Get your blood test done every year. I think
I'm
in 1
on
year,
it. I am on it. She said her colleague has it. So, yeah, I did feel like I, had developed some kind of Victorian disease for not eating enough vitamin C. It is not that. And it is something to be aware of. Dr. Radha, I really appreciate your time. Thank you so much.